The city is joining with community health centers to reduce the racial gaps in access to nutritious food. The initiative is focused on residents of public housing, and it's known as Reach PHH, which stands for Racial and Ethnic Approaches to Community Health, Partners in Health and Housing. To tell us about it are the director of Boston Reach for the city's Public Health Commission, Aileen Shen, and from the Whittier Street Health Center in Roxbury, Brus, Guerrier. Thank you both very much for being with us. I want to start with Aileen. Talk about the disparities that we knew about, I think, even before this program got started.
Definitely. So we know that there's poverty, food insecurity, and obesity in Boston, as it is, across the nation. But we really want to tackle this, and this opportunity came up through federal funding called Reach. It's a 4-year project funded by the Centers for Disease Control and Prevention. And in Boston, our priority population are African American, Black, Hispanic, Latino residents who are BHA housing residents who make up about 80% of the population there. And they unfortunately bear an equitable burden of poor health outcomes. And so we really want to tackle that in the project that we're working on. And so this is a partnership between Boston Public Health Commission, Boston University, and Boston Housing Authority. It stemmed from this partnership that's been going on for over 15 years. So we were ripe and ready for it. And so what we're doing is we're addressing increasing access to healthy food and beverages, also increasing smoke-free environments, and then making some linkages with the community and the clinical settings.
Aileen, you mentioned food insecurity. It's not always the same as hunger, but it's a serious problem. So what does that mean exactly?
So food insecurity means that folks don't have enough food to eat. You can't necessarily tell by looking at someone to know whether they're food insecure or not. And so it's been really wonderful. We've been working with 4 community health centers in Roxbury, South End, and Jamaica Plain. They're Whittier Street, Upham's Corner, South End, and Southern JP. And the clinicians have all gotten on board to incorporate food insecurity screenings into their workflow. So they're now asking 2 questions of their patients, at least piloted in like a particular department, to identify who doesn't have enough food. Either they're worried that it's going to run out by the end of the week or month, or they've been in a situation where they haven't had enough money to buy more food.
Brus, explain why is it so important for somebody at a health center to start a conversation about food?
Well, it has a direct impact on your health. I mean, nutrition is vital to being able to be healthy. That's basic wellness. So we do this to be able to get information directly from community members to ensure that we can factor that into our care plans that we design for each patient. Every family is different, every child is different, but the basic truth is that if a child is hungry or food insecure, then their health is going to suffer, and therefore academic performance is going to be a problem. And in the future, they're going to have this perpetuation of the poverty cycle, which affects everything else. So we make it our mission to help bridge the gap, the social and economic disparities at the healthcare level.
And of course, you're not just talking to people in the health center, you're going to where they live.
Correct.
What's that been like?
Correct. It's been a great experience. We have basically hired members of community, the housing developments themselves, as Whittier employees. We train them on the social determinants of health, and therefore they go back to where they live and they contact their fellow residents. They get information directly from them, and they're able to be more comfortable that way. They're speaking to someone who know what's going on in the community, and they come back to us and help us to develop programs that are more innovative and also targeted to their particular needs, as opposed to things that we just imagine or read from reports.
Aileen, I know from your work with one of the other health centers in Jamaica Plain, maybe things are even worse than they used to be, because even though in this neighborhood there is a chain supermarket, but they lost High-Low Foods, which specialized in foods for the Latino community. It's been replaced by Whole Foods. And I guess people, they are still in a position where they have to go pretty far out of their way to get affordable food that's good.
Exactly, yeah. The youth at Southern JP Health Center, or their South Street Youth, which is across the health center, they created a video kind of explaining to the clinicians why it's easy to say or hear, eat healthy, but it's another thing to actually do it. And food access is really part of that. So now with Whole Foods, it's really hard. They have to go further away to access their food. And so they'll...
Even as far as Brockton.
Exactly. And not everyone has transportation, so that makes it even more difficult. So I commend the youth for creating that video and kind of expressing, their perspective on this.
So Bruce, when people from Whittier Street, they go to these housing developments and they talk to people and people say, yeah, I'd like to get more healthy food, but well, what can you do to help them?
Exactly. The thing is that the problems are the money. Accessibility is a problem, distance, you mentioned that, transportation is an issue. So we look at particular needs listed or identified when we meet with them at the housing developments and try to find resources that can actually meet those needs. Transportation, can we find a way to give them taxi vouchers, for example, or bus passes? We've done that. Or is it a question of accessibility of the food itself? We have these events at the health center, the fair food events, the food trucks. We have a community garden. We'll look at creating a workflow that actually allows them to be connected directly to food sources in the areas where they live, such as, for example, food banks in the area. But that's not enough. That's just going to help to fix the immediate problem of food insecurity. But the long-term goal really is to help them sustain themselves as people. So education, targeting the youth, is what we're looking at this point. We have these youth health coordinators that we've recruited to basically mentor their peers, so that way they can encourage each other to stay in school, to continue to learn, to be able to graduate from high school, for example. Roxbury has 50% less than high school achievement. So we're looking at increasing that, and that's the gateway to more economic security in the future, which it's going to have prevented long-term the food insecurity problem.
I mean, I know one solution, I saw this in the same video, the father of 5 children says, candy was a big thing with us before, and lately I've been substituting fruit. So I guess people are doing this on their own.
Yeah, people understand, they know what is healthy, and so they're making decisions to actually eat healthy whenever they can. They want to eat healthy. We've encountered Boston Housing Authority residents who lived on farms and they love produce. It's just a matter of actually accessing it. So it's been really great to work with these 4 health centers, as well as some of the nonprofit food partners that Bruce just mentioned, Fair Foods, Fresh Truck, Boston Foods, who actually go to areas and provide food, whether it's a food desert or some other location. They can bring the food there through $2 bags, through Fresh Truck, which is on wheels, or Boston Foods, which is kind of like a CSA, and they bring boxes of protein and produce. And 2 of those actually use EBT, so patients and residents can redeem their food stamps.
Yeah, that's important. You have to go to somebody who accepts those. We should mention, if people want some more details, Aileen, you've got something on the Health Commission's website or something like that?
Yeah, if you want to learn more about the project, you can go to www.bphc.org/reach. PHH. There's also a healthy food and beverage guidance that Boston Housing Authority local tenant organizations created that has a number of resources in there as well for folks who are interested.
And Bruce, if people want to know what you're doing at Whittier Street?
Right, you can go to our website, it's wshc.org, go to the Programs and Services section under Wellness Initiatives.
Great, thank you both very much. Bruce Guerrier and Aileen Shen.
Thank you.